Friday. This is how we end every week here at Remar Review. We get to dissect amazing NCLEX questions that we presented earlier through the week. And if it's your first time here, this is a mini NCLEX review for you. So welcome again. We like to call this segment. Hi, everybody. Hi, everybody. I'm going to talk about, I see the questions already. This is Let's Talk NCLEX. Thank you for joining. Stay right here with me. I am doing very well. Thank you so much for asking me. My name is Regina Callion, and I am the world's best NCLEX instructor. Interstellar, other planets as well. I like to claim this title, but I am the lead educator here at Remar Review. So happy to be sharing my experiences, my knowledge, my passion for passing NCLEX with you all here today. There are many of you on today, and there will be many of you watching throughout this weekend. So stay tuned because you're in for a wonderful treat. We have a lot going on here at Remar Review. We are so active with our nurse community, with the live events that we do and the study groups and the emails and the phone calls. And so this is a community where you don't just come in and sit down. You come in and you get to work. So I am really welcoming you right here. So the website that you can find, the home of Remar Review, is really simple. It's remarreview.com. Connect with me there. There are so many good resources that we have right there on that website that once you go to it, I'm telling you, you will get lost there because we have the free resources. We have the free trials. You can purchase the products that you see me talking about right here from that website. So check it out as soon as you get off this broadcast if you've never been there before. Now, I like to start every Let's Talk NCLEX with the motivation of all, like supreme motivation. And that is motivation that not comes from me. I mean, the little motivation that I provide cannot compare to those who have just recently passed their NCLEX. I mean, it's just a breath of fresh air. But I see you guys asking about this event. Hey, this is my scary NCLEX review. Oh my goodness. Are you guys signed up for this? Listen, I am doing next Monday night the scariest topics on NCLEX. I'm doing a free review on these topics. I mean, and the topics come straight from you guys. So I am doing select all that apply. I'm going to talk about these types of questions in detail because they are such a concern, a universal concern for every nursing student. I'm going to go over those fetal heart monitoring systems. Yes, you will know them. You will know them by heart. We're going to talk about the pharmacology. We're going to talk about those diseases that you see on NCLEX and you're like, what? Where? From whence did you come? Like, that's what you say to yourself when you see these diseases on NCLEX. I'm going to cover those, so it will be no mystery for you. Now, you have to sign up. And when you sign up, when you sign up, you are able to immediately download your workbook, okay? And the workbook is very needed for this event. You do not want to just be on Facebook watching me Monday night. It's at 8:00 Eastern time. You don't want to just be watching me. You want to actually be taking notes with your workbook. And it's about 19 pages, but you will be able to use this book throughout your nursing school. If you're in nursing school, this book will supplement those of you who already have my full package. You will be able to use this material on top of the full package. Oh my goodness, you're going to be so happy. You really are. You're going to be so happy. Nisi, I think I saw that you passed, huh? Nisi Thomas, you passed. I'm so happy for you. Oh my goodness. If you guys don't know Nisi Thomas, then you have not been attending these Remar Review lives. Her name is a staple. Tell me more. Like, what are you now? How was it? I want to see your video. So let me know about it, Nisi. Let me know what you have now. My baby loves to listen to you too. Hi. Thank you, Alicia. Thank you, Alicia. Okay, so I'm talking about the free review. Everybody on here needs to be present next Monday night, 8 p.m. Eastern Time. I actually have not done an advanced study session in a long time. It's been a long time. So I'm really excited to get on here and just show you guys this amazing information. Like, people ask me all the time, are you updating? Are you updating? Yes, I'm updating. When I update things, I just give them out to you guys. I just say, watch me on Facebook or whatever. So do this. All right. Sign up on the link and get your workbook, because Monday night it's on. It is on. We are going to study the scariest topics on NCLEX. You know, fear is something that fear and anxiety are two things that you have to be able to conquer before you take this exam. I find that you can be the most prepared nursing student. You could have studied, you could have done everything right, but if you don't address your anxiety, if you don't acknowledge that anxiety, you can sit down in front of the test and literally your mind just goes blank. Like, you can't remember, you can't recall. And that is one of the saddest things, when nursing students let anxiety paralyze them. So here, I'm really big on anxiety, like talking about it, addressing it. Other NCLEX reviews don't even mention anxiety. It's like not even a conversation that they're having with you. They're just like, exchange the money, I'll give you my books and you go study. But it's so much more than that. Like, there is a real process that you have to go through to be able to get through this exam with some mental peace. This is one of those exams where it can, oh my goodness. So, all right. So this Monday, once again, sign up. October 29th, mark your calendars, And let me say this to you guys right now. This is a live event. So this will not be left up for, like, we don't leave it up for like a day, maybe 24 hours, maybe. But next week and the week after in December, people will be searching for the scariest topics on NCLEX and they will not be found. So you want to make sure that you are present for this live event, because we are not keeping this up. All right. All right. So I talked about some amazing testimonials and some things that definitely will encourage you throughout this weekend if you're testing soon. Some of you guys are testing on Monday. Some of you guys are testing the Monday after. So here is our motivation. This is a picture of Nurse Jackson. So look, this is her walking across the stage. This is her walking across the stage, graduation day. I can say it over and over again. My faith is stronger than you think. I passed NCLEX 85 questions. Thank you, God. We did it. Nurse Jackson, I'm literally overjoyed. She said, praise God, praise God. I had the best classmates throughout nursing school. That's cool. You guys were more like teachers than students, so thank you as well. She shouts out all of her friends. Hey, Nancy Dixon, you're a friend too of hers. And she says, and Remar for NCLEX, hashtag quick facts was the truth. So cool, Nurse Jackson. She is a new Remar nurse. Man, congratulations. And then this is her as well. So God is good. She came back and told us that she had passed. All right. So your motivation for those of you who are testing, if she can pass, you can pass too. You have all the tools that you need. Don't give up. Don't give up. I know it seems like it's a really hard task. I know it seems like it's impossible to know everything. It's impossible to study, but try your best and go in there and demonstrate that you can be a safe nurse. Okay. So pass your exam, tell your story. You are the testimony to us. I know we say it a lot, but it's the truth. You guys encourage us to do more, to go above and beyond to help the next nursing student. So continue to motivate each other in the meantime while you study. So congratulations to all of our nurses who passed NCLEX this week. We salute you. We thank you. We want to see your video. All right. Another thing that I have been getting some emails about are people would say, hey, Regina, I'm ready to take the next step. I'm ready to get a package. I'm ready to, get a full program. I'm watching the YouTube videos all day anyways. Let me get your full program. So I wanted to tell you about the sale. Hey, there is a 24-hour sale beginning that day, okay, October the 29th at 12:01. We're going to start sales on the DVD package. So if you were waiting for a discount for that package, this will be that time. And that's going to be Monday, once again, for you to get that package. So over the weekend, decide what you want to get. And then on Monday, be ready to purchase it. All right. So it comes right in time with the scary NCLEX review. We're going to give you a scary, crazy discount on packages. Now, the reason why these packages will be so reduced and such a good value is because they are going to be lightly used, if that. I mean, like new is probably better because nobody has physically used them. But we had a surplus of packages that maybe like the front of the book was damaged or the side of the book, but they're still unused packages. So we're going to be just selling them. We're going to be just selling them. We're going to be just selling them. So it's a great opportunity for those of you who are financially trying to figure out how you're going to commit to a program. Monday, I'm telling you, Monday is the day for you. So I'm super excited about this event. And it's going to be amazing on Monday. Like, I'm really preparing. I'm really nervous. I was telling Mark, I'm really nervous to go before you guys again. So let's get into Let's Talk NCLEX. Are you ready? Are you ready for your NCLEX question of the week? Well, the first one actually comes from the Remar Instagram page. So we do questions of the week on IG. And if you are not following me on Instagram, why? Why not? We always do really cool things. We give discounts. We do giveaways right there. So here's the Instagram question of the week. Oh, this one is kind of easy, but here we go. I'm taking you back to the very first week of nursing school. I'm taking you back to your pre-nursing classes, all right, where you were in anatomy and a system was presented before you. And the system had the following organs. You had the pineal gland, and you had the thyroid gland, and you had the pancreas. All right. And so you need to identify this organ system. Is it number one, reproductive system? Number two, the lymphatic system? Number three, the circulatory system? Number four, endocrine? Or number five, the regulatory system? What saith you? What saith you? Sherry, you gonna Sherry wrote endocrine system. Oh, lovely. Says number four, endocrine system. Is there anybody else who would like to say something other than the endocrine system? Is there anybody else? Everybody is saying it's endocrine. Do we go with the crowd on this one? Do we go with the crowd, or shall we choose another path? Well, this is the one reason why I love the nurse community here at Remar Review, because there may be somebody who's like a first day nursing student and they're here with us. And so they can know that here at Remar Review, we share. Dorothy, don't do that, Dorothy. Don't do that, Dorothy. That we share knowledge. We share knowledge. So, so the correct answer is going to be yes, it's the endocrine system. It's the endocrine system. And I did throw in, let me go back here because I love the comment. She said, number four is the right answer, but number five looks suspicious, right? And that's what happens. Like, I love that, Larissa. That's what happens on NCLEX. People write questions that are just like me. So they put in things that might sound good. They might put in things that might sound good, but are way off. So please always go with your first mind. So number 4 is endocrine system. Yep. All right. So here's our question for the week. And this question was on Facebook, and man, oh man, did we get a lot of different answers. We need to review this priority today. And I know a lot of you guys are new to REMAR, so you have not gone through the full system, but I'm going to try to show you how to do these questions today. So here we go. Share this post. A nurse is working in the emergency department. Well, what do you have? 4 clients present needing immediate treatment. Which client is the highest priority? Well. So just looking at this question, we know everybody here is pretty much going to be ICU ready. So let's look into the patients. Who's the highest priority? Okay, the client with varicella who requires immediate airborne isolation. The client reporting breathing discomfort after cleaning for 2 hours with ammonia. Rate pain 4 out of 10. The client with a 7 centimeter deep laceration across the leg, partially showing the femur bone, saturating 3 pressure dressings per hour. The client with a blood glucose level of 505, experiencing 3 PVCs per hour. Wow. Wow. Okay. So we have actually 4 patients who are extremely high priority, but we only have to pick one. So which patient shall it be? I need all my REMAR nurses right now. I need you guys to identify yourself. Anybody that's gone through my DVD program, I need you to identify yourself and then put the right answer down. I need to know if what I'm doing is making a difference, because I see all kinds of answers. Here, but there's only one that is correct. All right. So I need all my REMAR nurses. Let me know if you've gone through my program and then put the right answer. Okay. Because it should be super clear to you guys. It should be really plain who the correct answer is. All right. Who the correct patient is. Oh, I'm seeing 4s. I'm seeing a 1. Which one is it? Write DVD if you have it. If you have it, write DVD and put the answer. Oh, no. Immediate. I get what you're saying. Pixie Dust asks, what's a PVC? Oh, no. Yes. So, okay. All right. I'm seeing 3s. I'm seeing 2 or 4s. You cannot do that. You have to get into the habit of committing to one answer. Okay. All right. I got to go. I really have to go. Pony, thank you so much for that shout out. REMAR DVD package and Quick Facts was my NCLEX PN. Literally. Wow. Thank you so much for that. We shouted you out, so I'm glad you were here. All right. So let me do this. Let me go. All right. So you guys see the answer. Right here. I'm going to show it to you. Out of these 4 patients, patient who is going to die first? Thank you, Hope. Thank you for putting that up. So if we're looking at it like that, the client reporting breathing discomfort after cleaning for 2 hours with ammonia, rating the pain 4 out of 10, is your priority, is your highest priority patient. Okay. So, and the reason why is the client with the airway issue, they're the priority because they're experiencing an airway problem. So their inhalation is damaged, right? They have a burn, basically. They have an injury by a chemical substance. That ammonia can damage the breathing passages, right? They're very sensitive. So if they're complaining of breathing discomfort, they are starting to have some upper airway trauma happening. And right now, because there's only 2 hours away from the event, it's only a discomfort, rating it 4 out of 10. But is that an abnormal assessment? Are you supposed to have pain when you're breathing? Not at all. Not at all. So this patient has the airway issue. This patient has the airway issue. Let's look at the other patients. All right. Let's look at the other patients. So the client with varicella who requires immediate airborne isolation. What is the issue with this patient? It's right there. They just have varicella. All right. But because I threw in the word immediate airborne isolation, it triggered your mind to say, oh, this is the priority patient. But what happens while you're getting airborne isolation and you're gathering equipment to put in this patient's room? What's happening to your patient with the breathing issue? It's progressively declining. They're not receiving any intervention. They may need oxygen, and you're trying to get boxes of gloves and gowns to put in a room. So that's not going to be the safest thing for the nurse to do. All right. Let's look at the other ones. Number 3, the client with a 7-centimeter deep laceration. Yes, this is a pretty bad condition. This is really bad. Basically, you have a patient, their leg is half open. You see the bone. But if we think about our priority mindset, we think about airway, breathing, or circulation. What kind of issue is this? You have bleeding out. This is a circulation issue. So this patient is going to be around a lot longer than somebody in respiratory distress, right? Because how long do you have when you're in respiratory distress to live? You have about 6 minutes. Okay. So y'all need to share this video. You guys need to share this video because this is how you're supposed to approach these prioritization questions when everybody looks bad, right? Everybody looks bad. So let's look at the last one. This client here, they basically have a high blood glucose level. And a lot of you maybe have seen the 505 and thought, wow, that's really, really high. And it is a very high blood sugar level. But I've actually had patients who have had blood sugars of 1400. Like the blood sugar can be very, very high and the patient will still live. All right. So, and another thing there was the 3 PVCs per hour. If you don't know what a PVC is, I need you to look it up. It's a premature ventricular contraction. You are not worried about 3 per hour. All right. You are not worried about 3 per hour. So, I mean, these are the kind of things. This is why content is so important. This is why content, Melody Jones, you passed. Thank you. Thank you for coming on here. You're a REMAR nurse. I'm glad to have you. Feel free to teach. I want to see you. This is amazing. Pearl, you passed as well. Thank you guys for busting in on my teaching today to let us know that you are REMAR nurses. Congratulations, Pearl. Congratulations, Melody. I'm trying to do this broadcast. I'm just getting the motivation from you guys too as well. So the prioritization questions have to be assessed from a value point of literally what patient is going to die first. All right. So that's why number 2 is the answer. Cindy, you gonna come on here too? You passed your PN 85 questions. Wow, 20 SATA questions. That's a pretty rough test. I want you guys, if you're afraid of those select all that apply questions, definitely sign up for Monday's class. Okay. So listen. It's all a process. And it takes practice. And I'm here to walk you through how to do these questions because they can be tricky. They absolutely can be tricky. All right. So congratulations again to everybody. I'm with you, Marlene. Congratulations, everybody. We are talking about our four patients here and who is the priority. Now, I want to switch gears a little bit. I want to switch gears to ask REMAR. So I got a couple questions. I got a lot of questions this week, but a couple I want to address here. So I got to ask REMAR, and they asked, hey, Regina, when do you chew nitroglycerin? Now, I get questions from all over the world, literally people in all different nursing programs in all different phases. So because this question was asked to me, I thought, well, I better go on Facebook Live and address this. I emailed them back too. But so yeah, when do you chew nitroglycerin is a very interesting question, because the answer is what? The answer is, yeah, I like that. It's never. You do not chew it. You do not crush it. You do not swallow nitroglycerin. They are sublingual tablets. All right. So they need to be placed under the tongue or between your cheek and gum, and it dissolves. So I thank you guys. I really do thank you guys for sending me in the questions, because sometimes they bring me back to my beginning nursing roots, and we address it. Okay, so Yvonne said, Regina, please show me this kind of question. Please do risk reduction of risk potential questions. Whoa, okay. All right, so I have an example here of one that you guys may like. All right, and it's this one. Basically, another student asked me the question, can you help me understand a cold burn when I see it on NCLEX? Can you help me understand a cold burn when I see it on NCLEX? Would anybody like to write right here what a cold burn is? Would you just like to share the definition of it for the remark community? Would you please? Anybody? What is a cold burn? It's like crickets right now. Okay. All right. So I'm going to proceed with the question. Oh, Simone. Okay. All right. So Simone's here. Here we go. A nurse is caring for a client diagnosed with a cold burn. Which of the following actions should be included in a treatment plan? Okay. This is a reduction of risk potential. All right. So select all that apply here. We're talking about a cold burn. What are we going to do? So number 1, oral pain meds. Number 2, warm water bath for 15 minutes. 3, thrombolytic therapy. This is select all that apply. 4, massage to promote tissue perfusion. And 5, cold reintroduction therapy. So give me some numbers. Ooh, I got it. Yep. So I am looking for the answers right here. So here we go. Let me give you the answer right here. All right. Well, let me just review. Okay. So basically, yep, a cold burn is when ice or another cold thing comes in contact and damages your skin. So usually this is extreme frostbite. So what do we do for frostbite? What are our nursing interventions? All right. You guys should have 1, 2, and 3. Hey, I see a couple people who got it right. Yes. Okay. So 1, 2, and 3. You definitely want to give those oral pain medications for frostbite, because it is very, very painful. Also, to warm up the skin, they will do gradual warm water baths, like nothing hot, but just gradually warming up the area. And then thrombolytic therapy will be super important. It'll be super important because the blood there is literally like what? It's literally almost frozen in place. So when you warm up the skin, there is a big potential that you could have blood clots. So those are very important topics when you are approached with a question about a cold burn on your NCLEX exam. All right. You would not massage the tissue at all. You don't do that. All right. Because if you have blood clots there, you could literally damage the skin. You can break free a clot. You just would not massage. Also, putting another cold substance, cold reintroduction therapy is really something I just made up. So it doesn't even make sense. You would not put a cold substance on a limb that is frostbitten. Okay, so you got it. Perfect. All right. Oh my goodness, you guys. You guys have been so great with studying with me today. And I hope that wasn't too hard on you. But you guys know how I am. I just really want you to succeed. So as I close, let's talk NCLEX. I want to remind you guys again, the link is all over the Facebook page. You should also go to the website if you cannot find the link on the Facebook page. The class starts Monday at 8 p.m. Eastern Time. It is going to be amazing, amazing. You don't want to miss it. This is basically a free NCLEX review, a 2-hour free NCLEX review. You need to have your workbook. You need to have your workbook in front of you. All right, put the kids to bed. Get your dinner done, all this stuff. Make sure that you're able to study with me. All right, so this is the way to go. This is the way to go on Monday. Free 2-hour NCLEX review. It will be live. It will not be up for months and months and months. So thank you so much, you guys, for studying with me. Our motto is we can, we will, we must pass NCLEX. So I will leave you all with that this weekend. All right. It is going to be amazing. All right. I look forward to seeing you guys. Have a great weekend. Bye.